Hello everyone, this is Dr. Keerti Rani, an eye specialist, cataract and vitreoretinal surgeon. In today's video, we are going to discuss about the various lens options available while you are planning for cataract surgery. So let's begin. Most of you got confused when your eye surgeon or your ophthalmologist told you that in market at present you have various lens options available, and out of these various lens options you have to choose one. So most of us got confused as we don't have any specific knowledge about these lenses. So in this video we will discuss about the various lenses, and this video will help you to choose one lens out of all the lenses. So let's begin. We have to understand that what are your requirements and what are your expectation after you have been operated for cataract. So if you are a person who want very crystal clear vision while you are looking at the far objects, but you are comfortable with using glasses while you are working at your laptop or screen, or while you are looking at mobile phone or reading something. So if you are that kind of a person, then the best lens which is suitable for you is a monofocal lens. Monofocal lens are those lenses by which the objects which are placed as a far distance are very crystal clear, and for near reading and for working on the laptop and screen you have to use glasses. Out of all the lenses which we have in the present era, these are the best lenses as the vision is very crystal clear with these lenses, the contrast is very high, and there are no problem associated with these lenses which are seen with other lenses, which we will discuss in this video further. Also, if you have any diabetic retinopathy or any other retinal pathologies, like you have any age retinal macular degeneration and other retinal diseases which are affecting your central part of retina, that is known as macula, then in these cases only monofocal lenses are advisable, as in these lenses all the light ray which is coming into your light is focused on the retina, and hence the vision is better as compared to the other lenses. Now coming to the second group of people who don't want to use any kind of glasses once they have undergone their cataract surgery. So for these kind of patients we have lenses option available such as trifocal lenses, multifocal lenses, and also the extended range of vision lenses. With all these three kind of lenses you will be able to see the objects which are placed at a far distance. You will be able to see your desktop screen, and you will be able to read, write or do any other near activity. But you have to keep in mind that for very fine works, for example if you are a jeweler or you have very fine intricate near work, then in these cases you have to wear additional extra plus power glasses while working for such a intricate and delicate things. Otherwise, if you are a person who have to do day-to-day activities, you have to do daily newspaper reading, you have to do daily mobile reading with a good size font, then in these cases you will be comfortable with these lenses. But if you have to read very fine font and you have very delicate small work, in these cases you have to wear extra plus power glasses even after opting for this trifocal, multifocal or for the extended range of vision lenses. Now out of these three lenses, that is the trifocal, multifocal and the extended range of vision, which one is best? As per my knowledge and as per my experience with the patient, I have seen that out of these three, trifocal lenses work best, and patient in whom the trifocal lens is implanted, these patients are happiest among all these three kind of lenses. So in my opinion, you should go for trifocal lenses if you are opting for such kind of lenses. The main problem which most of the people faces with trifocal, multifocal or with the extended range of vision lenses is that in their vision they see multiple ring like structure, and for some patients these rings are very disturbing and they are not able to see clearly. So if you are a very sensitive person and you are not willing to tolerate these rings in your vision, and if you are a person who have a lot of night driving, you have a lot of night work, then in these cases it's better not to go for such kind of lenses, and in these cases you should go for monofocal lenses. Before opting for these kind of lenses, there are few important things which you should know. The most common problem which patient faces after going for these kind of lenses is that they see multiple ring-like structure in their vision, and for few patients these rings become very troublesome. Most of the patients who are highly motivated not to use glasses and who are highly motivated on mindset level that they will go and they will adjust with these rings, they are able to adjust with these kind of rings, and after few months they don't have any difficulty in their vision. But if you are a sensitive person who are not willing to adjust to these kind of rings, then you should not go for these kind of lenses. Also, if you are a person who have a lot of night driving, and if you have a lot of work during night time and you have to go out of your home for these activities, then in these cases you should not opt for these kind of lenses, because I have seen that if your work is like that, you have to go outside the night time, then these patients faces very difficulty in their work. So in these cases it's better to go for monofocal lenses. Also, if you have some retinal pathology, for example you have age-retinal macular degeneration, you have diabetic retinopathy, or you have some other pathology in your retina which is affecting your central retinal area, and then in these cases it's better to go for monofocal lens, as the vision in these cases is much more better with the monofocal as compared to the trifocal lens. So if you are a person who is ready to sacrifice to some extent on your contrast part, on your brightness part, on the sharpness of the vision part, and you will be willing to adjust to this ring-like structure, and you don't have any night driving work, then in these cases you can go for the trifocal lens or the multifocal or the extended range of vision lenses. Third kind of lenses which we have are the toric lenses, and these lenses are advisable only in those patients who have cylindrical power inside the eye. So if you don't have any cylindrical power inside, then you don't require such kind of lenses. Coming to the cost part of these lenses, out of these three categories, monofocal lens have least charges. Then after monofocal lenses, the cost of toric lenses come, and then after toric, the multifocal, trifocal or the extended range of vision lenses are the most expensive one. Now this is not a sponsored video, but in my experience and in my knowledge, I have seen that lenses from the Alcon company and the lenses from the Johnson & Johnson AMO company works very best, and very good results are seen with these kind of lenses. So now let's summarize all the things which we have discussed today. In summary, if you are someone who is ready to wear glasses for your desktop work and also for your near activities, then the best lenses for you are monofocal lens. But if you are someone who is highly motivated not to wear any kind of glasses after surgery, and you are able to compromise on your few things, like you are ready to compromise on your contrast, very sharp vision, and you are able to adjust the kind of rings which patients see, then you should go for trifocal lenses. And if you have cylindrical power inside your eyes, then you should opt for the toric lenses. So that's all for today. If you like this video, then please hit the like button. And if you have any queries regarding today's topic, then you can type in the comment box. And if you want to see such informative videos in the future also, then please subscribe our channel by hitting on the subscribe button below. So see you on the next video. Till then, take care of your precious eyes. Thank you everyone.